Hello everyone, I am Dr. Akhil Tawari, consultant spine surgeon, and today I would like to discuss a very important and a dangerous condition if not managed properly, and that is the condition of spinal tuberculosis. Yes, so spinal tuberculosis is very much possible, just as tuberculosis can affect different organs of the body, including the lungs or the abdominal organs. We also come across cases of tuberculosis affecting the spine. In fact, it is one of the most common extrapulmonary, that is the organ apart from the lungs, which is more commonly involved in the body, and that is the spine. So how do the patients present to us? The patients usually present to us with severe back pain. They present to us with constitutional symptoms such as difficulty in eating, loss of weight, loss of appetite. They also typically tell us that they get up in the middle of the night with pain, and even turning in the bed becomes painful. If the condition is ongoing for a long time, the patients can present with severe pain, weakness or numbness in the legs. They can also lose their bowel and bladder control. We have also seen patients who have presented to us very late and they have come with deformities in the form of spine alignment completely changing because of the organisms that have eaten away their vertebra. Hence, if not detected early or treated early, this can have disastrous consequences. Once the patient presents to us, as usual, we like to ask the patients specific questions and also like to evaluate, including a neurological examination. That helps us to know where the functional status of the patient is. Then we start investigations. Investigations usually start with X-rays, which tells us the alignment of the spine, but inadvertently, we also like to get an MRI scan done. MRI is one of the most powerful ways of detecting spinal infections, and while it cannot differentiate between the infection caused by a bacteria or a TB bacteria, Mycobacteria or a fungus, it can at least help us to know if there is any infection or not. Secondly, tuberculosis is notorious because it can affect different parts of the spinal cord, and MRI is a powerful way to not miss out on different areas which can simultaneously be involved, which we call as skip lesions. We also like to do blood tests that helps us to know how bad the infection is, and also some surrogate tests such as ESR and CRP. We also like to get nutritional status, and as a routine we like to get chest x-ray done and sputum examination done to know if the patient's lungs are also involved. Once we have a confirmation that there is some spine infection that is going on, we usually like to isolate the organism. So as we know that there are different organisms which can affect the spine, tuberculosis is one of them, and hence we like to isolate that organism by usually getting a biopsy. This biopsy is performed under CT guided so that we can exactly localize the area from where that organism has to be isolated. And once we have that organism, we subject it to numerous tests to exactly isolate the organism. The other important thing of biopsy is once we know what organism, we can also know what antibiotics will work against that organism. As we know that for tuberculosis, there are first line drugs which are more commonly used, but if there is resistance that is seen on these tests, that means these first line drugs cannot be used, then we like to subject them to second line drugs. It's important that biopsy be performed every time, otherwise we will always be in the blind. We have had cases wherein the patients have been taking tuberculosis treatment and ultimately were not getting better, and we found out that because biopsy was not done, we couldn't really know whether the medication that the patient was taking was actually helping the patient or not. Majority of the tuberculosis of the spine can be effectively managed with medicines and rest. However, if the patients present to us later on, then we might have to sometimes offer the patient surgery Surgery is usually for complications that have set in, such as the patients have become weak or paralyzed, or if the spine has become completely unstable. It is also important to understand that tuberculosis can also be seen in children as frequently as in adults, and we have had cases in which the children have presented to us with even severe deformities in which their spine are completely bent, and then we don't have any option but to offer surgery. It's important to isolate the organism and start the patients on medications, but at the same time also improving the hygiene and nutrition is equally important. Medications will work, but we also want the patient's immunity to fight a battle against tuberculosis. In most cases in spinal tuberculosis, the treatment goes on for at least a year, and we routinely involve infectious disease specialists for treatment. As a spine surgeon, our role is only for taking care of the complications. If detected early and proper protocol followed, spine patients usually recover completely and the prognosis is very good. So the take home from this is that do not take any back pain or leg pain that is disturbing your sleep lightly. If you have any contact with patients who have had tuberculosis in the past, please get yourself checked at the earliest. The best treatment for tuberculosis and the best outcome for tuberculosis in the spine is only if we are able to detect it at an earlier stage. In later stage, we then end up offering surgeries, and in case you need more help, please feel free to get in touch with me or my team.